interesting case. Nice young lady, 31-year-old, nice lady from the Northeast, comes in with a set of implants that she had in 2013. Now she ended up having an MRI which showed that both of these implants were ruptured. And so this was kind of, I use the word, an emergent kind of a add-on, if you will, because remember, when you have a rupture, you do not want to make the intracapsular rupture an extracapsular rupture. So you don't want the inside internal spilled contents coming out, if you will. Spilled meaning you have the shell of that silicone implant, in which is where the supposed nicer, better, safer, cohesive implant is. We don't want that to come out of the capsular and capsule and become extracapsular. This is where, if someone finds out they have a rupture, there is an urgency into removing them, number one. And number two, don't work out, don't do contact sports like karate or basketball. And this is the end block. So as you will see, I cut out the excess skin on the right, and you will see this is relatively very inflamed tissue on the surrounding area, especially down here too. So I removed anything that was hard, abnormal. You never know, there could have been a focal spillage. Now what I'm going to do next here is if you can continue on, I'm going to have Dr. Omar, can you switch my light off? Appreciate it. So now I'm going to go ahead and cut this open, and per MRI, this is just a 12-year-old set of implant, and we will see what it shows. So this is right now just going in. I can see this is what appears to be a textured implant. I am going to go ahead and go in. Texture implant. You can actually hear it. The way, so very important point that these are textured implants, and overall appears intact, by the way. So now I'm going to use my finger to dissect. And you can actually hear how the textured nature of the implant literally super glues, sticks to the implant. And remember, textured implants, they were the ones that were notorious for what is that rare BIALCL, even though the smooth ones are also implicated. And you know what's interesting is, you know, a textured implant is still a textured implant, right? You know, there are a new set of implants that are out there now, the Motiva implant. Remember, this is just like saying there's this nice safe cigarette out there. You know, they all, so if you look at this here, very interesting. So there's no such thing as a safe cigarette, right? There is no such thing as a safe implant. This does not cause as much inflammation. Well, guess what? It does cause inflammation, right? And the smooth implants are also implicated in a problem. Now look at this black area, very focal, isolated, very interesting. And remember, all done en bloc. You never know what you're going to find. Now this is what appears to be so far an intact implant. So the MRI, oh, there we go, there's some fluid here. Not enough to send, but what I'm going to do, more if you have this. So I'm going to just, for completeness, it's too small to send, small amount. You never know what you're going to find. None of this spilled into the chest. And you know, this nice lady did her homework. She was very well read. And again, you have to always assume the worst. And look at this gel-like consistency. I'm going to still send this small amount. No, you know, they say 3 cc's. This is too small to send. Remember, I'm going to send this with the specimen. So this is your Allergan implant. intact implant. Now let's look at this area of blackness right here. I'm gonna send this off. I'm going to send this off to pathology separately. And I'm going to take cultures of this area. I'm going to send this off as a mass separately because I'm just curious to see what it is. So this is your Allergan, 375 grams. Textured implant intact, not ruptured. Not enough fluid to be sent to. Now you will see right here. Look at this. People ask me why remove all this bad tissue because it's all angry, inflamed, irritated, and look at this gel-like mucus consistency. Again, if you will, this is the area where this tissue was. It's like a pimple, if you will. I'm going to take cultures of this area because this is very much representative of what was inside. So I'm going to send this as an intracapsular mass. I'm going to take cultures right here so we have a very good representative sample. And remember, I'm not taking, so I saw another plastic surgeon just send a small piece off. No, you want to send the whole thing off, especially this one, because they want to get a good representative sample. And this is the whole purpose behind the end block. The other thing I want to show here is this. Look how thick this tissue is. I'm going to cut this open. You can see I'm barely able to cut through it. And this is my very sharp scissor. And this is why I have removed the tissue behind as well, because I want to capture all of this irregularity, all of this hardness. Some areas so small, you can see my glove right here. Some areas so thick, this is almost half, like 1 centimeter thick right here, half a centimeter thick here. So I'm going to remove my top sterile glove now. And then I'm going to work on the left side. And again, this goes to showing you, I don't need an MRI. She got one on her own. Left side, full thickness skin for contouring. The distance from the nipple down to the crease was the same on both. And again, end block, the gold standard. Again, according to the MRI, this is supposed to be ruptured, and so we will see. This 12-year-old set of implants, now I know this is what it is supposed to be also textured. You always assume the worst because you never know what you're going to find inside. It's like in 2 months and 4 days you're going to be opening up the Christmas gift. You never know what's on the inside. So as I go in here, all of this tissue is bad, abnormal. It's not healthy. So you can see how thick this capsule is. The body's trying to do its good job to defend itself, wall off the badness. This tissue, if left behind, if you ask me, the misery is going to be left behind. So in my practice, I remove all of this bad tissue. Here we go, entry point. So also intact implants so far. And so the MRI again was wrong. And as you can see, just like any test, there's false positives and false negatives. Now I'm going to use my finger to dissect. That's the safest and the best way without hurting the implant. I'm looking for any fluid, any irregularities or masses. So you have to always assume the worst because that way you're prepared. You don't want to be caught by surprise. So going back to, all implants silicone, be it saline, be it smooth, be it the textured like these are, or the new Motiva implants. You know, the other day I heard a surgeon say, oh, these are safer, but guess what? Just like, is there a safer cigarette? No, it's not. So the same thing, you're going to ultimately find in long-term study and data, you're going to see they're going to rupture, they're going to have inflammation, they're a foreign body, and so this is like a misnomer saying that they are safe. Again, the same thing, very interesting, focal area of badness, left intracapsular tissue, and I'm going to get like a, look at this dark matter right here. I'm going to send this off so the pathologist can look at it. All done en bloc, intact implant. 375 as well. And as you will see right here, look at this, it has a mustard color to it. And very thick. So what I'm going to do with this one, I am going to cut right through it. So I want to cut right through this. Very hard, as you can see. Very, you can hear me cut through like calcifications. Right here, look at that. So it looks like this is why they were probably thinking it's ruptured. So, abnormal. And again, left intracapsular mass. So overall, the take-home message here is no matter what implant, be it saline, silicone, smooth saline, textured saline, textured silicone, micro-textured Motiva, whatever, there's no such thing as a safe cigar, safe cigarette, safe cigarette with a nice big filter, because they all cause the same hurt as a foreign body. It's an inflammation reaction. So if you look at the histology, where the doctors have gotten together and they looked at the capsule that forms whenever any implant is placed, be it silicone or saline, there is an inflammation reaction 100% of the time, because the body recognizes this as foreign. So these are, MRI was wrong. MRI was wrong twice, because the MRI said both of these were ruptured, and the patient very clearly said that they were going to be ruptured as per MRI, and you never know what you're going to find. Number two, it was done en bloc, so all the badness was contained. I did not know I was going to find some small amount of fluid on the right side. I did not know if I was going to find those intracapsular masses on the right and left that I'm going to send separately. The capsules will be sent to pathology to rule out that rare BIALCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology. The fact that there is fluid, it was all contained, none of this go into the chest. Implants will be returned to the patient. Cultures for Arabic and fungal, especially that black area on the right and left, will be done separately. And then post-op, we will know with definitive certainty as to what it was and what it was not. And the patient is going to have the peace of mind and that tranquility that when she sees this Facebook Live, she knows that she got the best surgery. 20 years from now, I cannot imagine anyone else doing the surgery any differently. She's only 31, absolutely no point in doing what is an unnecessary lift. She recoiled very well right on the OR table, and I couldn't be happy with how the whole case went. This is Dr. Khan, Executive Plastic Surgery.